I'm Marty Ross MD, and welcome to another Conversations with Marty Ross MD. I'm here to help answer any question you have about Lyme disease, and I'm hoping that we can find ways to improve your care. Realize that any question you ask is something that somebody else is probably thinking about too. And so in answering your question, and the response that I give will also give insight to other people as well too. Okay, so just a couple logistics or some logistics things here. You can write questions to me through at the bottom of the screen is a chat box on the right-hand side. Write your question there. When you write your question, please try not to hit enter as you're writing a question. Write it as one long run-on question. When you hit enter in the middle of writing, it actually posts as two questions, and that makes it difficult for me then to share those questions with you when I do so here in a few minutes, okay? The second thing is tomorrow morning, I'm going to wind up sending each of you an email that has a link in it to the recording from tonight's webinar. So you'll be able to go back and hear things that you might have missed if you want to review those things again, okay? All right. So with no further ado, let's go ahead and get started. Again, I answer these by taking, try not to take more than one question per person. Sometimes I will, depending on if we run out of questions. Sometimes we do. We've got a large number of people that signed up for tonight, and so I'm not quite clear if we're going to be able to answer more than one question per person, but we'll see how that goes, okay? So quickly, let's see. Crystal had asked a question about, is this where she asked her questions? The answer is yes, Crystal. Write your question down in the bottom of the screen in the chat box, okay? Let me get rid of that. Let's see, Pamela says, good evening, Dr. Ross. Hello, Pamela. And I also saw something from Natasha here earlier. So hi, Natasha, to you too. All right, so let's go ahead and get started here. Pamela said, good evening, Dr. Ross, too. Let me get rid of that. Hello, Pamela. All right, so let's go ahead and get started. So this first question is from Carol. Now, I just want to let you know, logistically, when I click on the question, it will show on the screen for those of you that are live. It does not show up in the recording. The reason you keep seeing me look sideways, though, is it doesn't show on my screen, actually. I have to read it from my sidebar over here, okay? So you'll see me looking to my right side. So Carol says, I was clinically diagnosed with Lyme, I believe that's 2.5 years ago. I did the protocol with an ILADS physician in Columbia, Missouri. I feel like I'm doing well. I have not been on antibiotics for a year now, but the site of the tick bite keeps welting up and itching. Maybe does this mean, maybe does this once a week? What does this mean? All right, I think, Carol, I thought I saw that you posted a second part to your question here. I thought I saw, oh, there we are. Here's the second part to Carol's question. It only stays like this for maybe 20 to 30 minutes, and then it goes from red, swollen, itchy to nothing. What can tell anything was ever, you can't tell anything was ever there. You know, Carol, I don't know why that's happening. I haven't seen anything like that happen before. It sounds like you're having an allergic reaction or something that could be like hives, for instance. So you're reacting to something. I'm not sure why there. In terms of whether it could be from having parts of the Lyme or the tick left in you, usually the body's going to break those down. So I don't think it would be from having a tick parts left in you that your body would be reacting against it. Clearly, there would be some Lyme germs possibly there, even when you're done being treated, as most of you know. My feeling is, and many of us that believe that when you have Lyme for a year or more, when we treat it, we're not able to get rid of every germ. So yeah, you could have some Lyme parts there, but it sounds like you almost have an allergic reaction. And I'm not aware of people actually having allergies to Lyme too. So Carol, I'm not quite sure why that's happening. One thing you might want to do, well, no, I actually don't have any ideas on that one. All right, good luck to you, Carol. So many of you know this is a hard illness, and we don't have, I don't have, my colleagues don't have answers to everything. There's a lot that goes on in this illness that is not explainable. And unfortunately, we don't have a lot of science in this illness either. So a lot of what we're doing is based on a collective experience of those that treat. And we share with each other, we try things, we experiment with our patients, and we see what happens, okay? So I may not always have answers for each one of your questions tonight, everyone. All right, next question is from Pamela. Hi, Pamela. See, good evening, Dr. Ross. My Western blot results are IgG positive at 28, 31, 41, 58, and indeterminate 39. And then on the IgM results, positive at 18, 58, and indeterminate at 41. What are your thoughts? Do I have Lyme? Okay, so let me just look at your Lyme test, which even when it's positive does not prove you have Lyme. I'm going to say more about that in a minute, okay? But in terms of looking at your test, so everyone, what a Western blot is a method that we use to see if your immune system has made antibodies that attach to proteins found on the covering of the Lyme germ, okay? So you can think of antibodies as being, they're proteins, but think of them as being like a big antenna tower that attaches itself to the germ. And what it does is it sends out a bunch of signals to the other parts of the immune system, the cell part of the immune system, to come in and gobble up the germ, okay? That's how you can think of an antibody. It's a big signaling device, all right? Now, the antibodies don't attach to the whole germ. They just attach to specific proteins. When we do a Western blot, many of us that do Western blots do it through either a lab out in New York, the State University of New York at Stony Brook, or SUNY Stony Brook, or we do it through a lab called IGenix. And the reason we tend to use both of those labs is when they do a Western blot, they tell us, they look to see if we have antibodies against 12 proteins, which is more than what the test kit does when you do it through a standard lab. The standard labs, like a LabCorp, a Quest Diagnostics, or a PAC lab, use a test kit approved by the Food and Drug Administration, and it does not look to see if you have antibodies against as many proteins. That's why the IGenix or the Western blot done through SUNY Stony Brook is more comprehensive. They look to see if you have antibodies against more proteins, okay? Now, I consider a Lyme test to be positive, and most of us that treat Lyme consider Lyme testing to be positive when you have antibodies against 2 of 6 different proteins. And the 6 of those 12 proteins that we look at, the 6 ones that are the important ones, are the one at 2325, that's one protein. The other protein at 31, 34, 39, 41, and 8393, okay? What those numbers are, everyone, those are the weight. We identify the different proteins by what they weigh, okay? That's what those numbers are. And you may have seen them referred to as bands, okay? So if you have antibodies against 2 of the following 6 bands, you have a positive test. So again, that's 23, 25, 31, 34, 39, 41, or 83, 93. So looking at your IgG test, your IgG antibody family, you were positive at 31 and 41, and that's what got you that positive test, okay? Having antibodies against those 2 proteins, all right? So when we do the Western blot, we also look to see antibodies against 2 families. There's IgM antibodies and there's IgG antibodies. When you first get sick with any infection, it's IgM antibodies you develop, and in most infections, except in Lyme, after you've had that infection for about 6 weeks to 3 months, the IgMs will go away and they get replaced by IgG antibodies. Once you develop IgGs, they will always remain even when the infection is gone, okay? So your IgG was positive, which means that at some time you have had a Lyme infection. I cannot tell by looking at that test whether it's still in you or not, okay? But it does say you've had Lyme in you, probably you still do, all right? Now the IgM, I just want to say one thing about that in Lyme. Even though I said in all infections, it's supposed to go away by 6 weeks to 3 months, there's a phenomenon that happens in Lyme whereby about 80% of the time that somebody has Lyme of a year or more, the IgMs remain positive, all right? 80% of the time, that's what I see and that's what my colleagues see. Unfortunately, the infectious disease doctors look at that and they say it's a false positive because it doesn't fit the model of all other infections, okay? Now that interests me because instead of the infectious disease doctor saying, wow, This happens 80% of the time. That's interesting, but they knee jerk and do it. They just say it's a false positive instead of exploring why, okay? And so anyhow, it is what happens 80% of the time. I don't believe that's a false positive. But many of you that have IgM Western blots through IGeneX or SUNY Stony Brook that are interpreted as a positive, if you've had Lyme for more than 3 months or so, the infectious disease doctors would call that a false positive. They're wrong, okay? So Pamela, to answer part of your question, yes, you do have a positive test for Lyme, all right? All right, now, how do we decide if somebody has Lyme though? Well, there's actually 4 things we consider, and none of these give you the diagnosis by themselves, okay? So your Lyme test could be a false positive, actually. Any test can be wrong, okay? So the 4 things we look at are, what's the risk of getting the infection? So for instance, somebody that gets a tick bite in New Jersey, where about 95 to 100% of the ticks are shown to carry Lyme, that's a high risk, okay? Somebody that's a deer hunter anywhere in the country, that's high risk. Somebody that's an avid outdoors person, that's high risk, okay? Even if they don't remember a tick bite, 50% of the time that somebody has Lyme, they don't remember tick bites, okay? All right, second thing we look at is, do your symptoms fit with what Lyme disease can look like? And is there anything else that can explain it? All right, we make sure there isn't something else that explains it. Third thing we consider is, do you have any physical exam findings? And then the 4th thing we consider is there a supportive test? Notice I said supportive, I didn't say diagnostic. A test doesn't diagnose an illness. We have to put everything together and say, does it make sense? Tests inform us, they don't diagnose, okay? And you can have Lyme and have a negative test. In fact, 20% of the time that we diagnose Lyme disease, people do not have a positive test, all right? Now, I want to show you, I've just kind of gone through how you diagnose Lyme quickly. It seems like I talked forever here. I want to do a quick screen share because I want to show you an article that we have that you can use to, I want to show you an article that, why is that happening here? History. I'm going to show you an article that basically, or I'm going to show you our Treat Lyme book, okay? So I'm in the Treat Lyme book now, everyone, all right? And this is our table of contents. Within the Treat Lyme book, this is at our main website, the Treat Lyme and Associated Diseases site. This is where many of you came to actually sign up for the webinar. Here's the webinars tab down here, okay? But there is a chapter we have on how to diagnose, okay? And within that chapter, if you scroll down here, you're going to see there is an article I have about, that I wrote called How to Diagnose Chronic Lyme Disease More Than a Test, okay? Do you see the title says More Than a Test, okay? So this is the article, and what it actually is, this is an article that is a 15-minute video from a webinar that I did on how to diagnose Lyme, and includes lots of information about the symptoms. I explain a lot more about testing in this article as well too, and the issues about false positive tests and why you don't have to remember a tick bite to have Lyme, okay? So take a look at this later. I want to let you know the Treat Lyme book is available by subscription. There are over 70 different articles that we have built into each one of these chapters. Pretty much you're going to find most information you need about Lyme disease to either design a lot of your treatment using supplements or to help discover new ideas that you can use to inform your doctor of things they may not even be thinking about, okay? In fact, many physicians subscribe to our Treat Lyme book and find it useful as well too, okay? So if you have not done so, I'd consider subscribing to the book. If you are not subscribed, when you click on any article within one of these chapters, if you click on it and you're not subscribed, you will find the subscribe page, okay? It will pop up and say subscribe, okay? And then one other thing I get asked sometimes, I'm subscribed and I keep getting the subscribe page. If that happens to be you, what you want to do is in the upper right-hand corner of that subscribe page, there is a link that says, if you are subscribed already, sign into access. Click on that sign into access and then you will be able to get into the whole book, okay? So anyhow, I encourage everyone, sign up for the Treat Lyme book. Actually subscribe to it. There are 70 articles in it of useful information that you can use, including this one that I just showed you about how to diagnose chronic Lyme. All right, thanks for that question, Pamela. let's see. So this is from Cindy, and she says, no questions at this time, but thank you for creating this webinar. Thank you, Cindy. I appreciate that. I like having these webinars. I like helping as many people as I can with this illness, both in my office, but also these webinars I think give a lot of useful information. It's part of my mission to help as many people as possible with this crazy thing. All right, thank you. All right, let's see here. Next one is a question from Natasha, and unfortunately, it's not allowing me to post. Just bear with me here a minute. What I'm going to have to do, Natasha, is I'm going to rewrite your question or repost your question as a question for me, and then I'm going to post it here. So just a minute. All right, so this actually, everyone, I know my name is showing up at the top of this, but this is from Natasha, okay? She says, hello, Doc Marty. Thank you for this webinar and all of your help. You're welcome. Can you explain the connection between gut and brain pain? Whenever I eat, and I eat a very clean paleo diet, it causes the pressure on my brain, my major symptom, to get worse. Is there any anti-gut inflammatory supplement, okay? So that's a great question, Natasha. So first of all, let me try to explain what the relationship is first, what I think the relationship is, and then I'll talk about what you might do for it, okay? So the largest part of our immune system actually lines the gut, okay? And when somebody has chronic Lyme disease, one of the things that happens is the immune system, not along the gut, but all throughout the body. What happens is white blood cells, when they see Lyme germs, react against those Lyme germs by making a group of chemicals called cytokines. Cytokines are good and bad. On the good side, cytokines help create more white blood cells. They draw the white blood cells to where the infection is, and they help those white blood cells work better, okay? That's all great. However, in chronic Lyme, the immune system does not do a good job getting rid of the germ, and it keeps trying and harder, and eventually it produces too many cytokines. Too many cytokines give you Lyme symptoms. In fact, most of what we call Lyme symptoms, most of what we identify for Lyme symptoms like fatigue, brain pain or head pain in your situation, body pain, lack of ability to think, all those symptoms that we would call Lyme symptoms, most of those are due to excess cytokines, okay? Now, if we have something else that triggers cytokines, those cytokines get into the bloodstream, float up into the brain in your case, Natasha, and give more pain, okay? So let's talk about what happens at the gut level then. So there is a phenomenon which is called leaky gut syndrome, okay? And to describe that, I want to talk about the intestinal architecture, all right? So I'm going to try to use my hands to do this, and I'm not going to be able to draw a diagram, but I think you'll get it, okay? So there's the inside of the intestines, okay? All right, and inside the intestines is where you have your poop and your stool, okay, and undigested food parts, and also bacteria that line the intestinal wall, okay? So you got the inside of the intestines, and then my fist, these are cells, okay? So there's one layer of cells, I can barely see, one layer of cells, okay? So you got the inside of the intestines, one layer of cells that butts up against each other very tight. Then below the cells, you've got a bunch of immune cells under here. Remember I said the gut lining is the largest part of the immune system. Okay, they sit right underneath the one layer of cells that lines the intestines. And then under these immune cells that are in kind of a matrix here, there's a blood vessel, okay? The way that things get from the inside of the intestines into the bloodstream is they get absorbed, taken up by these cells, okay? They're touching really tight, there's no gaps, okay? They get absorbed into the cells, they pass through these immune cells, and then they get into the bloodstream down here. All right, so these cells are a barrier. They're a filter device that are made to keep things out that shouldn't get through, like toxins, things that we might react to in our food, even if you're on a paleo diet, for instance, okay? And they do so by, you have to absorb through here, you can't get through. All right, now, if you get chronic yeast infections, or sometimes Lyme infections of the gut lining, these are parasite infections, okay? Or fungus, mold fungus infections. These cells plump up and pull apart. And now what happens is whole pieces of fruit can get, or big pieces of fruit can get through. Big pieces of gluten can get through, okay? Big pieces of brown rice can get through. Big pieces of meat protein can get through, okay? Now when I say big, I'm talking relative to the gut lining, all right? And what they hit here are all these immune cells, and they're not supposed to be getting to the immune cells in a big size, okay? And what those immune cells do is they react by making allergy chemicals, but they also can react by making more cytokines, okay? And those cytokines that get into your bloodstream, float up into your brain, and probably cause the pain, all right? Now, I have no science that proves that's the exact mechanism of what's happening in you, but knowing what I know about how the gut works, the gut lining works, and what's happening with your symptoms, I think it's a very possible idea. What I just explained, I think explains what's happening with you, all right? So what do? Well, we want to help heal your gut by getting fungus out if it's there, by getting yeast out if it's there, by getting your Lyme under control. And eventually these cells will stop plumping up and pulling apart, and they will touch each other again, okay? In the meantime, you can take a supplement that helps the gut lining heal, okay? And what I like using is a supplement called GI NCAP. That's ENCAP. So it's the letters GI, then a space, and then NCAP, ENCAP. It's a product by Thorne. Thorne, everyone, is what I like to call pharmaceutical grade supplement. We use in our practice and at our supplement store, we use Thorne products and many other products that we choose because we know that they have a good chance of working. Thorne and the other brands that we choose to work with in our supplement store, the ones that our patients buy things at and you can too. We choose products that have the greatest chance of having good active ingredients and also that don't include artificial fillers that can harm you, okay? And so I'll show you our store here in a minute. It's many people ask me, where do I get my supplements? And where do we get the ones that you would use? Well, you get them through our store, okay? And that's called Marty Ross MD Terrabrook ND supplements, all right? I'll show you where that is here in a second. Anyhow, what GI NCAP has in it is it's got licorice, which when you get licorice in the body, licorice is dissolved and forms a gelatinous microscopic coat. It has some mallow in it. Mallow protects and heals. It also has some L-glutamine in it. Glutamine is a fuel source for the cells that line the intestines that help it to heal, okay? And then it also has some slippery elm in it, I believe, okay? But that product, what is in the GI NCAP, actually, we'll go look at it here in a minute. I think I just remembered all the ingredients correctly. That product can help your gut heal. I usually have people take about 2 or 3 pills 3 times a day of that, okay? So let me go ahead. I'm going to do a screen share here again. And let me see. Bear with me here, everyone. I've got a new computer tonight, and I'm trying to understand how to do my screen share thing here. It's not doing it quite the same way it did before. One of my Apple computers died, and I had to get a new Windows computer, and unfortunately, it's not behaving the way that my last computer did. Let me see. No. All right, so what's going to happen when I hit share here in a minute, it is going to do some weird things on your screen. Here we go. All right, so here we are on, this is our Lyme disease site again, okay? Oh, actually, I want to go over to our supplement store. So this is the supplement store. It's called Terrabrook ND, or Marty Ross MD Terrabrook ND supplements. And through here, you'll find the various products that we recommend that we use in our patients. In the Treat Lyme book, we only use the generic names, but this is what you would do. And here you can see, this is a list, for instance, of the various manufacturers that we use that we find to be the best possible in terms of working, and those that tend not to have ingredients in them that could actually harm you as artificial fillers, okay? All right, so I'm gonna look up GI NCAP. I need to refresh my memory. What's in it here? All right, so there it is, and in the ingredients, let's see. So it's got Oh, banana in it too. It's got mallow, it's got the licorice, and it has the slippery element, okay? All right, so this is one thing that would kind of line your gut with slime, okay? The other thing I would do, though, that I did mention is to actually use something called L-glutamine powder. And L-glutamine is actually the fuel source for the cells that line your intestines, especially in the large intestines, okay? And what you would do with this is I would do 1 scoop of this 3 times a day, and it gives the fuel to the cells in the intestines to actually heal. So I would do the GIN cap that I just told you about, and I would do this as well too, okay? All right, let's go back here. All right, so Natasha, I hope that answers your question. And everyone, when you look at getting supplements, again, you want to make sure that you're using ones that have the greatest chance of having active ingredients. There's been a lot of studies done out there that show that most things in the supplement store, the grocery store, do not use ingredients that are active, okay? They may be in there, but they're not good ingredients. The other thing is you want to use products that do not have artificial fillers that could be toxic to a person with Lyme. So if you're looking for sources, take a look at that Marty Ross MD Terrorbook MD supplements, okay? All right, let's go on here. So thanks for that question, Natasha. All right, hello, Carol. Oops, we answered that already. That's the second part of your previous question. Let me get rid of that. All right, hello, Kaylee. Let's see, what evidence have you found that just one parasite medication will treat all forms of parasites? You know, we don't have, Kaylee, it's a good question. There is no science that says that any one medicine treats all forms of parasites, okay? The one that I prefer to use, though, is something called Alinea. And the mechanism by which Alinea works, it should work against all major parasites, okay? And that's the best I can say about that. Now, I will use it by itself first, and I usually try to use it for about 3 to 4 weeks in a person. If we get done and they still are having problems, I might come back and try something called Biltricide. Biltricide is an anti-parasite medicine that was designed to treat liver flukes, but seems to have good benefit against all kinds of parasites, okay? So everyone, what do I think about treating parasites? So parasites that I like to focus on are intestinal parasites. And when you have Lyme disease is actually what we call a total load phenomenon illness, where perhaps if you had parasites without having Lyme in your intestines, they wouldn't bother you. But you throw Lyme in on top of it, and then the parasites also become part of the problem, okay? All right, so when somebody has Lyme, we try to look at removing as many problems as possible to help regain health. We don't have to address every problem, though, okay? So for instance, somebody may have intestinal parasites, Bartonella, Lyme, yeast infections, hormonal problems, and heavy metal toxicity. And we may be able to just correct the hormones, treat Lyme, get rid of parasites, and not deal with any of those other problems, and they'll get well. Okay, we don't have to correct every problem that happens, okay? All right, so regarding parasites, so when I think about parasites is if I've got somebody with a lot of mushy, watery diarrhea, we treat yeast and that doesn't improve, I might think about parasites. One way that we can look at it is to do a stool culture, stool testing to see if they have parasites. But the trouble with parasites is they often are there even when you can't see them on a stool test, okay? Other people that I'll think about parasites in are people that have done a lot of international travel. And even if they don't have intestinal symptoms, sometimes if their Lyme is not getting better, if their disease is not getting better, I might think about treating for intestinal parasites too. All right, so those are kind of the big situations that I might think about doing it. If you want to read more about intestinal parasites, one thing that you could do is to go to our Treat Lyme book, and in our chapter on how to treat, let's see here, infection treatment plans right here. There is a more involved article than what I just said about killing parasites. It's called Kills Parasites, a Brief Guide, okay? Click on this, you'll see some more information then too, all right? Let me go back here. All right, thanks for that question, Kaylee. Kaylee, unfortunately in this illness and in many things that we do regarding the other situations to develop in Lyme, we don't have a lot of good research. It just hasn't been done. So a lot of times what we're doing is working by experience. And I know that you may want to know for sure that something is going to work. I don't have a for sure on this one. The best I can say is knowing the science about how it works. It should get at most, if not all, parasite infections, okay? All right, good luck to you, Kayla. And thank you for that question too. All right, let's see. Hello, Art. So Art says, can you suggest another source for lufenuron other than shop.owndoc.com? It doesn't seem to be available there. So everyone, lufenuron is a medicine that helps break down, or actually, let me start over again. So yeast have a covering that is a hard covering made up of something called chitin, all right? Chitin is kind of a fibrous substance. And there is a medicine called lufenuron that makes it so that the chitin cannot be synthesized. So it's a chitin synthesis inhibitor, okay? It blocks chitin synthesis, all right? Now, lufenuron is something that for a while I was using to treat treatment-resistant yeast. So when people would get yeast infections that nothing else was working on, I would use lufenuron. There was one high-quality source that came out of Europe at this site. Unfortunately, the authorities in Europe have shut down the ability for that person and her product to be sold internationally. I don't have another source, and in fact, I'm no longer able to recommend it to my patients. I know I still have it on the yeast article. I need to remove that because it's no longer available for purchase. And I don't know that I would trust any of the other sites that are out there that might offer it. I would suggest if you're looking for other options to treat yeast, I'm going to do a quick screen share here again. What I would do is I would take a look within the Treat Lyme book again. And right now I'm in the Articles and Infection Treatment Plan section. You can find it through our table of contents. Take a look at our article called Kills Yeast, a Brief Guide. And in here I talk about okay, anyhow, I talk in this article about what you can do to treat yeast, okay? And there's a video that goes with it as well too. The only thing that I would say though is ignore the parts in here that are about lufenuron. I have to correct that. Everyone, so you may know, you may be aware, I haven't devoted much attention lately to the Treat Lyme book as I went through summer and some issues that I was dealing with here. But I'm hoping over the next week to start getting back to writing new articles for the Treat Lyme book and also updating some articles that need updating. And that yeast article is one that needs to be updated. I need to pull out the piece about lufenuron on it, okay? All right, so you should start seeing some stuff coming out, new articles that will be coming out from me shortly, hopefully within the next week or two. And as those become available, you might want to just check back periodically to see if we have some new articles available too. And eventually I will send out updates through our email list about those new articles being available. All right, so Art, thank you for that question. All right, let's see here. This is a question from Debbie. Let's see. Hello, Debbie. I had a nasal swab that showed large amounts of Marcons positive. Do you treat this, and if so, how? I am being treated currently for Lyme Bartonella. Thanks, Debbie. All right, so everyone, Marcon stands for methicillin-resistant coagulase-negative staph. All right, Marcons. The CONS stands for coagulase negative, the S is staph, okay? So there's a physician, let me explain what that is. There's a physician named Richie Shoemaker that is a family doc that lives out in Pocomoke, Maryland, which is a town on the Chesapeake Bay. And he's developed a whole elaborate science around something that he calls chronic inflammatory response syndrome, okay? And essentially what he has done is he pioneered a lot of work that shows that about 25 to 30% of people are not able to remove Lyme and or mold toxins, okay? So he does a lot of work on what we call biotoxins, and I've written some articles about that. I'm not going to go into all that right now. I'll show you an article in a minute that you can look at it, okay? But keep in mind that 25 to 30% of people are not able to remove Lyme and or mold toxins, and it is the thing that could keep you ill if you're not getting better. And in fact, one of the things that I suggest doing is that in 6 to 9 months, if you're not getting better in your Lyme treatment, consider looking at this issue of Lyme and mold biotoxins, among other things. And I'll show you that here in a second as well too, okay? Now, with Dr. Shoemaker, when you have one of these mold problems, or Lyme mold problems, Lyme and or mold problems, and you treat it and you remove those mold toxins using something called cholestyramine, and a person doesn't get better, then he starts looking in his protocol for other sources of ongoing inflammation. And one of those is that people sometimes will develop an infection from this germ, methicillin-resistant coagulase negative staph, okay? And that can become a source of ongoing inflammation too. Now, I've done lots of Shoemaker's protocol, even the steps after that. I frankly don't find much benefit of going after the methicillin-resistant coagulase negative staph, but I will try it sometimes in people. And what you need to do is to be on a medicine called rifampin. It's an oral medication. You do 300 milligrams, 2 pills, 1 time a day. The other thing that you should be on is a nose spray that is made by a pharmacy out in New Jersey called Hopkinton Pharmacy. And it's called a Beg nose spray. And what it has in it is it's got a medicine called Bactroban in it. It's got something called EDTA, which is a chelation agent that can remove minerals from something called biofilms that cover these germs. And then it's got something called gentamicin in it as well too. Gentamicin can kill the germ through your nose. The EDTA removes slime layer that covers that called biofilms. And then also the Bactroban also is another antibacterial that can help too, okay? And that's a proprietary blend made by Hopkinton under the direction of Dr. Shoemaker. I believe it's a couple puffs 2 or 3 times a day. I always have to look it back up again. All right, but that's how you would do it, Debbie. Okay, so I want to show everyone something. I mentioned a couple things here. I'm going to do a screen share here. Okay, so here we are back in the Treat Lyme book. All right, so if you're not getting better, there's various steps that you can do, okay? And you might want to look at our chapter called Can't Get Better, Do This, all right? So in this chapter, there's a lot of articles. You can scroll down to see them down here, okay? But basically what I like to tell people to do is about 6 months or so into a treatment, if you're not getting better, start looking at various detoxification treatments and see if you might have those problems. And I list out what those problems are here, like Lyme and mold biotoxins. That's what we were just talking about. Think about whether you have biofilms. Look at whether you might have chronic virus infections that are part of your illness blocking your getting better. Look at whether you might have problems with your energy factories called mitochondria. All right. Look at whether you have co-infections that were missed. Consider if you might have an autoimmune illness. And this is situations where the immune system attacks you as a result of having Lyme in you. Okay, and look at whether you've gotten yeast out, okay? So every one of the things I mentioned here has articles that back it up below. So for instance, we have an article called Lyme and Mold Biotoxins, where you can get more information about what I briefly described. And let's see here, I'm just gonna show it to you. Okay, here's our article on Lyme and Mold Biotoxins, okay? And I've created a video that goes with this as well too. Take a look at this. I even talk about Dr. Shoemaker down here at the bottom and the steps that you can take to figure out if you have it, as well as what you can do to treat it, okay? All right, let me go back. Okay, so again, everyone, if you want to look at the Treat Lyme book, and there's lots of useful information, I'm not going to cover all that tonight. If we have it, and I can steer you in that direction, take a look at it there. Again, it's available by subscription, but you'll find that your resources are very well spent. You get a lot of practical and even do-it-yourself information or information you can share with your Lyme doctor to help bring them along if they're not familiar with some of these concepts that we have found to be effective out here. Okay? All right. Thanks for that question, Debbie. Let's see. Hello, Amber. Let's see. My nerve pain is so severe that I've been unable to sit for over 3 years. I'm sorry to hear that, actually. Liposomal glutathione, NT energy, liposomal curcumin, and Lyme BART treatments with no improvements. How do I know if it's nerve damage? EMG tests were normal, or still infection causing it? Thanks. Okay. So Amber, I would need to know some more things to really give you the best answer to this question. Okay, so I'm just going to do a generic discussion, but you may want to sign up for so that I can really make sure I give you the best answer here, because I need to know more about the type of nerve pain you're having, the qualities, how it spreads, etc. I need to know more specific things here. Okay, but one of the things you could do to talk to me more about this is I offer an online video consult service called One-to-One Medical Consults. There's information about it on the website that I keep showing you. In a minute, I'll show you how to do that. And I can actually visit with you over the internet for 30 or 60 minutes and come up with a comprehensive treatment plan for you, help figure out what's wrong too. I'm glad to help with that. Doing these consults, though, I cannot prescribe nor can I order tests because I haven't examined you in person, and my medical board would not be happy if I do that. But I can tell you what to do. And if it does require prescriptions, hopefully you can take my note to your doctor. They may prescribe it for you. Many of the things I recommend are herbal and natural treatments that you can implement on your own as well too. Okay, but I'd be glad to help explore this a little bit more with you. And everyone, if you happen, anyone here that wants to have more direct input from me, you can sign up for one of those one-to-one consults. Okay. So anyhow, Amber, so nerve pain, the way to figure out if you have nerve injury in situations like this, even when the nerve studies, the nerve electrical studies, like an EMG test is normal, ultimately you could do something called a biopsy of the skin, where they can look and see if you have injury to what are known as the small fibers, okay? Now, that doesn't tell you whether it's permanent, though, but if you do have that, then it is another clue that, yes, you really do have nerve injury, but I don't know if you necessarily need it. You already know you have nerve injury, okay? So everyone, qualities of nerve pain can be burning, sharp, stabbing, shooting, piercing, electrical. I think I mentioned all those, okay? So Amber, I suspect you're having some type of pain like that, okay? In terms of what to do for your pain, boy, you're doing some good stuff. So everyone, the way that you repair nerves is you work through a bunch of different angles, okay? Number one, get nerve inflammation down. And that's what the liposomal curcumin does. It lowers cytokines that are made in Lyme. And I've talked about cytokines earlier tonight. Okay, curcumin, 500 milligrams 3 times a day. You want a liposomal variety because liposomal means fat-wrapped, microscopically fat-wrapped, which increases the absorption. We use a product called Mariva 500 by Thorne. It's also a liposomal glutathione product, okay? All right, so get the inflammation down. Second thing you want to do is to try to repair the nerve membrane, okay, the cell membrane. That is made up of a group of fats called phospholipids. And the NT factor energy, contains those phospholipids. It also is designed, the NT factor energy is designed to repair energy factories in your cells called mitochondria. Those can get injured when you have chronic infections like Lyme. They get injured because there's increased oxidizing agents that run around our bodies because of having these, okay? So the NT factor also repairs your energy factories in your cells, And when you have nerve injury, that also helps the nerve repair. Okay, so NT-factor energy helps repair the nerve membrane from the outside and helps repair the energy factories to power them up, okay? And in fact, NT-factor energy is something I use in people about 6 to 9 months into their treatment. If they still have a lot of fatigue, it's one resource that you can use to help repair those energy factors, okay? And you can find more information about it in the energy chapter within our Treat Lyme book. I talk more about how to use NT-factor energy and how it works, how long it takes to work. I'll tell you one little clue about it, though, is that if you use it correctly and you use it over a 2-month period, there's studies that show average energy improvements of about 40%. Okay, this stuff is real. It does work really well. All right. All right. So you're going to repair. So number 1, use your curcumin to get inflammation down. Number 2, repair the cell membrane. That is what you're doing. Number 3, power up the energy factories. That's what you're doing with the NT-factor energy. And then finally, try to repair the cells from the inside. And that's what the glutathione is doing. Glutathione is a very powerful antioxidant made in every one of our cells. The liver, in particular, uses it to pull toxins out. Okay, so it helps with detox. It also is a powerful antioxidant that lowers cytokines as well, too. And then the third thing it does is it actually gets inside of the cells and repairs cell damage, okay? So, Amber, you're doing about everything I know to do here, okay? And definitely treat your infections. In terms of helping with nerve pain, I would hope that people have looked at ways of treating that with you. Nerve pain can be helped using an herb called L-theanine, which leads to a greater production of a chemical called GABA. L-theanine is found in green tea. It's not caffeine, though. Okay, it's a 100 milligram pill, and you can dose up to 1,200 milligrams a day. It's 100 milligrams. They usually have people take anywhere from 2 to 4 pills 3 times a day. You might want to give that a try. Prescription options for nerve pain include doing something called gabapentin, something called Lyrica. Those are some things to consider for nerve pain, and I suspect your doctors have considered some other options as well, too. All right. Sorry you're having such a bad time there, Amber. Okay, so I'm going to do a quick screen share here again. I think I'll do a quick screen share here. All right, so I'm going back to the Treat Lyme book. All right, so here we are back in the Treat Lyme book. Now look here in the table of contents. In terms of how to do nerve repair, everyone, you might want to take a look in our brain and nerves chapter. Okay, and there's a whole article that covers what I just did. Neuropathy repair, heal that tingling, numbness, and pain. Look through this, you'll see all the things that I just talked about with that question, okay? The other chapter I want to just show you, because I mentioned it, is the chapter on energy and fatigue. All right, and in here, there's some basic steps. Read our article about fix fatigue, boost your energy, the basic steps, okay? But if that's not working, then you want to fix your energy factories. And those are the mitochondria. And talk about how to use the NT factor as part of doing that in that article. All right? All right, so let me go back here again. All right, thanks for that question, Amber. You guys are having good questions tonight. I'm enjoying this. I hope you're all getting something out of it, even though I know I'm being extremely long-winded tonight. All right, let me look at one thing here. Well, we had a big sign up tonight. I'm just looking at how many people signed up and how many are here. I'm glad you're all joining us here. And if you're finding benefit, I hope you would share it with your friends as well, too. Let them know about this, and even our Treat Lyme book as well, too. All right. So this next question is from Leonardo. Let's see. I have been on Lyme treatment for about a year, not very aggressive, typically using one antibiotic like Doxy, Zithromax, Ceftin, and pulsing a second one like rifampin with herbals, Cemento, Banderol. I struggle with depersonalization and weaknesses and wondering what helps. Okay, so boy, there's a lot I could answer here for you. And again, I would need more specifics. I'm going to make one point, but Leonardo, I know what I meant to show her. I meant to show everyone how to find our consults, how you get signed up for that. But anyhow, I'll show you here in a minute, Leonardo, because I am going to suggest you might want to participate in one of my one-to-one consults, okay? But when I see, so the antibiotics that you're on, the doxy, the Zithromax treat spirochete Lyme and intracellular Lyme, okay? Everyone, Lyme lives in you in 3 forms, and you need to actually treat all 3 forms to get well at the same time. Doxycycline and Zithromax treat 2 of those forms, which is the spirochete and intracellular Lyme. Septin is good about treating spirochete form of Lyme. And rifampin can treat intracellular Lyme and cyst Lyme, okay? All right. Cemento, Banderol treat all 3 forms of Lyme germ. They're actually good at removing biofilms, but you're using a really low dose there. I mean, I would actually be using up to 30 drops twice a day of that. Banderol, Cemento, everyone works as well, in my opinion, as any prescription antibiotic combination does. Okay, it's actually quite useful, quite effective. Works about 85 to 90% of the time. Okay. All right. Now, the rifampin that you're on can treat Bartonella, but I usually don't find it works well by itself. Usually, I find the best Bartonella treatments are ones that use 2 antibiotics. Okay. And so, why did I mention Bartonella? Well, Bartonella gives you a lot of psychiatric problems, okay, among many other things. So Bartonella is a co-infection, okay? And if you have depersonalization, yeah, it could be coming from the Lyme infection, but there's a greater possibility it's from Bartonella, all right? So how do you know if you have Bartonella? Well, depersonalization suggests it, all right? We estimate for Bartonella that there's 30 different strains, and yet we can only test for 2. So most of us that treat chronic Lyme make our decisions to treat for the co-infection Bartonella, another germ transmitted by a tick bite. We make our decisions to treat for Bartonella based on what the symptoms show us, okay? All right, so symptoms that make us think about Bartonella are pain on the soles of the feet, psychiatric problems like ongoing anxiety, depersonalization, depression, that's really bad, okay? Also, if a person has increased daytime sweating, that can be a suggestion. People that have restless legs, that can be a suggestion. Having bladder problems can be a suggestion. And having a lot of neurologic problems like numbness, tingling, or hearing sensitivities or sound sensitivities can suggest Bartonella. Even ringing in the ears can suggest Bartonella. The other thing is severe thinking impairment can suggest Bartonella. Now, you don't have to have all of those things, but if there's a number of those there, then you ought to treat for Bartonella too, okay? All right, so let me just show you a few things to consider here, Leonardo. I'm gonna go ahead and do a screen share again, everyone. Again, I'm trying to give you resources that you can look at later, some of them with even a more in-depth description than what I've been able to describe to you here right now. So I'm going back to our Treat Lyme site. This is Treat Lyme and Associated Diseases, of which the major part of the site is our Treat Lyme book, okay? But down here on the left-hand side, down at the bottom, you can find a link to our Lyme disease treatment guidelines. You can also find a link to our online consult, okay? So the online consult service is something called a one-to-one medical consult. You can read more about it here. If you are interested, give Christine a call at our 800 number, or you can write an email to us and we'll be glad to get back to you about it, okay? Read through how it works so you understand how this functions and you know that I cannot prescribe, okay? And take a look at our disclaimer about it too, all right? And then what the requirements would be. And if you are interested, go ahead and either call Christine here at a number, she helps set up with these appointments, or write to us through the email service here and we'll try to get you in, okay? All right. And then let's see, there was one other thing I wanted to show you. Oh yeah, I talked about how do you diagnose Bartonella, all right? So there is an article about how to diagnose Bartonella. It's this article called It Could Be Bartonella or Babesia, the Signs and Symptoms. And in here I gave you a detailed list of what those symptoms might be, and I explain why testing is really not useful, okay? And then finally, how do you treat Bartonella? Well, I said 2 antibiotic combinations are going to be the best way of going. Many of you may wonder, well, what are those 2 antibiotic combinations, okay? So to figure that out, you ought to take a look at our article, the one I wrote called Kills Bartonella, a Brief Guide, okay? I talk in this article about the various combinations. I describe what I call the strongest ones, which are tier 2 treatments, the next strongest ones, which are tier 2, and then herbal options, which I really only find the herbal options to work about 50 to 60% of the time. The prescription options are going to work about 80 to 85% of the time. Okay, so take a look at that article then. All right, so Leonardo, I hope that answered your question for you. And anyone that's thinking of the one-to-one consults, you now know how to find those. Okay. All right. Thanks for that question, Leonardo. All right, let's see here. That's a good question. All right, this is from Christina. And Christina, your question isn't allowing me to post it, so bear with me. I'm going to actually put it into my name and then repost it under my name. So hold on here. I just got to do a quick cut and paste. Okay, there it is. So this is from Christina, everyone. Hi, Dr. Ross. Is there any real scientific evidence that proves Lyme is sexually transmitted? The answer is no. But let me tell you what the science does say, okay? And then also describe an article that many of you may read about. Now, I will tell you, everything I'm going to describe is in an article about can Lyme be sexually transmitted. You'll find it in the Treat Lyme book. I'll show it to you here in a minute, okay? All right, so what do we know? Well, number one, those of us that treat Lyme do see a number of partners that have it, and it does suggest to us that it can be sexually transmitted. Although what I will tell you is I don't think we really know the true rates that it is transmitted, okay? I think it's quite low. I think it's probably 10% or less, but I think there is a possibility, okay? What else do we know? Well, there's been 2 studies that looked at specifically could it be in the fluids, okay? And in the body, in the vaginal fluid, and also in the male ejaculate. One of the studies showed that it's about 100% of the time it's in the female vaginal fluids in women that have Lyme, and in that same study it was shown that it was in the male ejaculate 50% of the time when a man has Lyme, okay? Second study was done and it showed the opposite results. It showed that it's in the male ejaculate 100% of the time, and in the vaginal fluid about 50% of the time, okay? So we know it can be in the fluids, all right? Then there was a very poor quality study that came out about a year ago that the authors concluded that it can be sexually transmitted, and one of them went even so far as to say publicly that we should be more concerned about what goes on in the bedroom than out in the forest. And I think that was way over the top. And I think Dr. Stricker, who made that comments, did a really great disservice at scaring a lot of people. I think he did it just to get, frankly, get attention personally. But Stricker has done a lot of work, good work in other areas, but on this one, I think he was just way off. Okay, so let's look at what his study showed. And the reason I want to talk about the Stricker study is you'll run across it if you start reading about, are there studies that show that Lyme can be sexually transmitted? And I do talk about it in my article as well too, okay? So what the Stricker study did is they looked at only 13 people. So first of all, studies that look at 13 people are not that good because we don't know what it means outside of those 13 people. You need large numbers of people to be studied to make any conclusion, okay? So that's one problem with this study. All right, what he did in his study is he looked, these were people that had Lyme, and he looked to see, was it in their fluids, okay? So vaginal fluid and in the male ejaculate. In all of 13 people, it was in the fluids, okay? Second thing that he did is in the 13 people, there were 3 couples, okay? So of the 13, there were 6 people that were coupled. That is a man-female couple, another man-female couple, another man-female couple, okay? And what he found in that study is that each of the man and woman that were looked at had the same strain of Lyme, right? Now that may sound scary, okay? Yeah, he made the conclusion that that proves that Lyme is absolutely sexually transmitted, okay? But there's a big problem with his study. And he doesn't report, nor can we tell, how long ago was it that the male actually ejaculated in the female, right? We don't know. And we have no studies that tell us how long does Lyme live in the vaginal fluid after it has been ejaculated by a man, into the fluid. All right, so we don't know when the last time these people had sex. There was no control done for it. So it is very possible when Dr. Stricker was measuring in the vaginal fluid of a female, even though it was the identical strain of the male Lyme, it may have been the male's Lyme strain that were in there because he ejaculated into the female, all right? So I don't know what to make of his study, and I think he did a great disservice telling everyone that we should be concerned more about the vector. I do think there is some concern about sexual transmission, but I don't think the actual rates of it are that high, okay? Now, this idea about sexual transmission raises a lot of questions for people, right? So there's other questions I know people may have based on what I just said. So I'm going to show you the article so you can see the questions that I answer in the article. So I'm going to do a screen share here. All right, so going back to the Treat Lyme book. Let's see. So I'm going to look through the table of contents. There's a chapter that we have on transmission. All right. And this chapter talks about how do people get Lyme. Okay, and I want to let you know it's more than ticks. For instance, there's some science that says that maybe mites and mosquitoes carry it, okay? Yep, mites and mosquitoes, okay? All right, so there's this article called Can Lyme Be Sexually Transmitted? Yes, okay? And in here I make mention of the Stricker study. I make mention of those other two studies that I was talking about. All right, it's got a whole video with it, okay? All right, but then here's the questions. Should I have my healthy sexual partner tested for Lyme? I answer it here, okay? Let's see. But shouldn't I have my sexual partner tested to prevent him or her from transmitting the germ back to me during or after treatment? Well, maybe. Should I tell my sexual partner that I have Lyme? Should we use condoms? Maybe. Take a look here, okay? So you're going to see what I answer here is kind of controversial. But these are my opinions on it, okay? So take a look. I think I answered the questions that most people have in this article. All right, there you go. Thank you for that question, Christina, and good luck to you. Okay, let's see here. Hello, Sarah. Hold on, everybody. I got to get a sip of water here. Let's see. Thank you for taking my question, Dr. Ross. Do you have any experience with using chlorine dioxide as a Lyme remedy? I have been using it for a number of months, and it definitely seems to alleviate my symptoms. I have heard very negative things about it. Huh. You know, I'm not familiar with it at all, Sarah. I don't even know how to comment about that. I'm wondering if you could send me a link to some information you have about it. It'd be good to take a look at that. My email address, if you want to do that and just want to take a look at that link, and I might comment about it in future webinars then, is my email is docmarty, DOCMARTY, at The Healing Arts, and that's THEHEALINGARTS partnership.net. I know it's a really long email, but it's docmarty at thehealingartspartnership.net. Okay. If you send me any link that you have information on that, it'd be good to take a look at it. I actually haven't heard of it being used, okay? Again, this is a crazy illness. People are trying all kinds of stuff. Some of it is valid, some of it isn't. And as many of you may know, there's also what I call the IT treatments of the season. Everyone rushes in a certain direction thinking a certain treatment is going to be it. That has been essential oils in the past, for instance. Earlier this year, the IT treatment was marijuana oil. Let's see, there's been previous ones in years before that. But anyhow, I'd be glad to take a look at that, okay? All right. The marijuana oil, everyone, is CBD oil, by the way. I just blanked there for a minute about the actual name. All right, thanks for that question, Sarah. All right, so everyone, I'm just looking through here. Some people have posted questions twice, and I'm looking at them and then erasing them, okay? So you don't answer them again. Okay, so this is a question from Crystal. Let's see here. Hi, Dr. Ross. Thank you for doing these talks. You're welcome. My 38-year-old son started treatment with a natural doctor I think you mean 2 months ago, I believe. I am wondering if there are bad health effects from clarithromycin twice a day for 2 months. He has had at least 3 herxes and is so ill. He has gained a lot of weight from the antibiotics. Okay. So I'd like to know more exactly how he's ill, okay? But using antibiotics in this illness is often required, okay? And it's hard many times to get better without getting worse first, unfortunately. When we treat Lyme, if we look at ways to kill the germ, you got to kill the germ ultimately. There are 2 herbs that can work quite well. There's the banderol cemento I mentioned earlier, also known as Otoba bark extract and cat's claw. Okay, cemento is cat's claw, banderol is Otoba bark extract, and even those herbs can cause reactions. Okay. When we treat Lyme, you need to go after all 3 forms. Banderol cemento to do that. Biaxin treats the spirochete form of Lyme and intracellular Lyme. And I would hope your son is actually being treated for the cyst part of Lyme too. Otherwise, some of the spirochete and some of the intracellular Lyme is converting into the cyst form of the germ. Now, when we kill Lyme, people can sometimes go backwards at the beginning of treatment, okay? And the reason that they go backwards is as we kill the Lyme germs, those germs release toxins, and the immune system responds against those toxins and also responds against the dead bug parts by making a group of chemicals called cytokines. All right. I already talked about cytokines tonight. Remember, I explained to everyone that the reason you feel bad in Lyme is that your immune system overproduces cytokines. Okay. So what a Herxheimer reaction is a cytokine flare against the dead bug parts and the toxins. Okay. So it can make it look like your Lyme gets worse. And in fact, what really is getting worse is you're just making more cytokines. Okay. That's my dog Thor back there, if everyone is wondering who just hopped up on the chair there. Let me get him away so he doesn't distract us. Thor, come here. Come here. Why don't you go on up here? Go on. Go up there. Go. Okay. Sit. Lay down. Lay down. Hold on a minute. Thor, lay down. Good boy. Thank you very much. Thank you very much. Okay. Where was I before the Thor disruption? I was talking about Herxheimer reaction. Okay, so people can feel worse because they have a Herxheimer reaction. All right, so what do you do about Herxheimer reaction? Well, there's things you can do. You want to lower cytokines, and some of the things you can take are curcumin. You can also use an herb called quercetin. You can also use something called glutathione, and that can be available. All these are supplements. The glutathione sometimes has to be given IV, or you have to take it by nebulizer, okay? So your son should look at doing some of these things to help alleviate some of his Herxheimer reaction. I think that's what's going on here. And yeah, Herxes can occur over months sometimes, okay? So let me show you an article that you can take a look at for the things that he can do to help alleviate that Herxheimer reaction, all right? So I'm going to do a screen share here. All right, so I'm back in. Let's see, did I do the screen share? Go back here. All right, so back in the treat line book here. All right, so there is, in our table of contents, we have a chapter called Herxheimer reaction and cytokines, okay? So I explain cytokines here, and we talk about what to do about the Herxheimer reaction too, all right? Take a look at this article called Herxheimer Die-Off Reaction, Inflammation Run Amok. I think it is actually one of our free articles as well too, okay? So you don't even have to have a subscription to take a look at this one. Talk about what cytokines are here, talk about how they're made, talk about why they're not necessarily good, and then I give you lots of ideas on what you can do to help lower the cytokines, okay? So take a look at this article later. I'm not going to go through all the details of it now, but take a look and you'll be able to figure out ways to help your son, okay? All right, everyone, so I'm back here again. Thank you for that question, Crystal. Crystal, I see you have another question, but I'm going to hold off on it to look at later if I run out of questions. Although I don't know if I can run out of questions. We've only got about another 15 minutes or so on the webinar. And I know I still have a number to go here, basically. All right. So let's look at a next one. So anyhow, Crystal, I may come to your question here in a minute, okay? But we'll have to see. All right, so this next one is a question from Eric that for some reason is not posting under his name. I'm going to repost it as mine, and then we'll put it up on the screen for everyone, okay? All right, so this is from Eric. Hi, Dr. Ross. I've been on antibiotics for Lyme for 13 months. I have read that while taking long-term antibiotics, you become completely depleted of vitamin K. Do you recommend supplementation? Thanks so much. Huh. You know, I don't know if I agree with that. And I don't specifically supplement vitamin K. I don't think you're going to hurt yourself by doing it, but I don't know if I agree with that premise, actually. All right. And I don't specifically supplement vitamin K, and I don't see people having problems. Okay. But I'm willing to consider it. I have to take a look and see if I can understand more about that. All right. Thanks for that question, Eric. Bear with me, everyone. I'm trying to get rid of some people, again, post their questions twice. So just want to make sure that we got that there. Okay. 1, 2. Okay. Hello, I think Tessa. Hi, Tessa. Why do most chronic people not test positive for the IgG Western blot? You know, we don't know. What I can tell you is I don't really know. And, as I said earlier tonight, about 80% of the time that somebody has Lyme is the IgM that's positive. Now, the reason we think that that happens, and maybe in a way this might explain why they don't get IgG, okay? So here's what we know happens. So, and to explain this, I need to explain what a germ covering looks like. So any germ covering, including a Lyme germ covering, is a layer of fat into which proteins are stuck, okay? And as I explained earlier tonight, when we do a Western blot, we're looking to see if a person has antibodies that have been made against 12 different proteins, multiple copies of 12 different proteins that we find on the covering of the Lyme germ, okay? All right, so what any germ covering is a layer of phospholipid fats into which proteins get stuck, all right? And there is a phenomenon that we know happens in Lyme called epitope switching, also known as antigenic variation, which is those proteins can move around, all right? So that is something we know to happen, okay? Now, here's the theory part of it. All right, so knowing that we have epitope switching, knowing that those proteins can move around, what happens to the Lyme germ is it's always changing what it looks like, okay? So sometimes, depending on what that protein pattern looks like, the germ may look blue. Sometimes it may look red. Now, they don't actually have colors. I'm just using that as a metaphor here, okay? But the germ is always changing what it looks like. And the theory is that because it always changes what it looks like, the immune system gets tricked into thinking it's constantly seeing a new infection, all right? Because the germ constantly changes what it looks like. It always looks new to the immune system. So the immune system keeps making the new infection antibodies called IgMs, okay? And because that happens, perhaps the immune system never gets triggered into making the IgGs, all right? That may be why they don't go on and actually make the IgGs, because it's still possible they can make IgMs and IgGs, but 80% of the time we don't see that to happen, okay? Now the thing that's interesting, and remember I said earlier about IgGs, is if you have them, we cannot tell if it's a living infection in you still, because all that we can say about IgGs is it's evidence that you had the infection in you. On the other hand, when somebody has IgMs, the only way that you can keep making IgMs months down the road, years down the road, is if you actually happen to have a living infection in you flipping its proteins around, okay? So the IgM is actually a sign, if it is positive, it actually means the germ is in you still, okay? All right, thanks for that question. It was a good question. All right, hello, Gloria. Let's see. I get another glass of water here, everyone. Okay, see, thanks for all you do helping. You're welcome. It's my pleasure, actually. Question 1 is, how long must cholestyramine be used? Is there a length of time? Question 2 is, I read recently where liposomal melatonin might be helpful in Lyme. Have you heard anything to this effect? Thanks so much. All right, so on the melatonin question, I haven't heard that it's specifically helpful for Lyme. Obviously, it helps to get sleep. Getting sleep helps your immune system work better, okay? That's one reason. The other thing that melatonin can do is there is a, when people have Lyme in the brain, when it's in the brain, not only does it cause the immune system to make a group of chemicals called cytokines that I've been talking about tonight, but it also can trigger cells within the brain to make a group of inflammatory chemicals called quinolinic acid, okay? Now, the ways to lower quinolinic acid are to use curcumin, which also lowers cytokines. I mentioned that earlier. I'm blanking. There's another herb you can actually use to lower the quinolinic acid too. But melatonin might be a way of actually lowering that quinolinic acid as well too, okay? I'm blanking on it. Japanese knotweed, I'm sorry. Resveratrol from Japanese knotweed can also lower quinolinic acid to a degree as well too. Okay, so curcumin, resveratrol from Japanese knotweed, or melatonin can sometimes do it. Now, in theory, melatonin I haven't used it for that purposes, and maybe that's what you're talking about in terms of helping Lyme. It would be to help with some of the neurologic effects from the quinolinic acid that's being triggered from having a Lyme infection in the brain, okay? All right, in terms of how long you use the cholestyramine, so everyone, cholestyramine is a toxin binder that can remove Lyme and or mold toxins. I usually suggest if a person has a problem with these, that they use it at about 2 to 3 scoops a day for about 2 to 3 months. If they get better, that they continue it, but drop the dose down probably to about 1 scoop a day to maintain the improvements, to keep up with the new toxins that keep coming in, okay? But what you want to do for the 2 to 3 months is remove the pool of toxins that has built up because people can't remove those toxins. And then after you remove the pool, you want to keep up by keeping up with any new ones that get made. All right? Thanks for that question. Let's see here. For some reason, I got one of those questions that's not posting again. I'll post it. All right, let's see. Who wrote this? Bear with me a minute. I'm sorry, I forgot it. I thought I copied your name here. This is a question from Kelly, everyone, okay? Hello, Kelly. Let's see. I am 15 days into IM Rocephin and have had looser bowels from the start. Today I've had stomach cramping and watery bowels. I have a C. diff test pending, but I think I might have a virus. Can I take the ProBoost? Okay. So everyone, IM Rocephin, IM means muscle injections, okay, usually butt muscle or on the side of the thigh. Rocephin is an antibiotic that we can use to treat spirochete Lyme. Primarily, there's some evidence it might actually help with the cyst form of Lyme, although it doesn't make any sense that it would, okay? But primarily spirochete Lyme. So one thing that can happen, we use antibiotics, either oral, IV, or butt muscle injections, is that we can cause a certain bacteria that lives in the intestines called Clostridium difficile or C. difficile to grow too much. It releases a toxin that can give you diarrhea. I'm doubtful that would have happened 15 days into it, but I do agree it might have been a good idea to go ahead and test for it, okay? I suspect it's going to come back negative, all right? So other causes of diarrhea can be just having a side effect against the antibiotics. And what you can do for that is to double your probiotics. So you should be on probiotics, which are bacteria that live in our intestines. Keep in mind that the rocephin is going to be knocking them down, and you need to put them back in because they help with digestion, okay? You also need to put them back in because if they get knocked down, yeast that live in the intestine can grow too much. And if you get too many yeast in your intestines, that triggers yeast overgrowth, which triggers more cytokines, and it makes you look worse. Okay, you'll get worse, all right? So use probiotics. Make sure you're using a probiotic product that is proven to repopulate the intestines or has a greater chance of working. And there's two we recommend. One is called HMF Forte, or the other one we like to use is a product by Research Nutritionals called Prescript Assist Pro that is actually soil-based. It actually is bacteria from the ground. And basically the idea behind that, and seems to do really good against treating diarrhea and also treating yeast. It would be my favorite to use in this situation. Why soil-based? Well, you know, basically over the last 100, 200 years, as we've moved further away from our food sources, we no longer go out and pluck the beets out of the ground. We've moved away from the residue that used to get caught on those, okay? So for instance, those beets, even when we clean them, would have soil residue, and that residue would have bacteria in it and enzymes from the soil. And there's studies that show that those residue, the bacteria and enzymes from the soil, do a better job of preventing yeast from growing. They promote GI health, and they actually help the immune system work better too, okay? So usually what I do when people get diarrhea on antibiotics, I have them first double their probiotics, and I also have them reconsider what they're using to repopulate their intestines. And that can even be using, sorry for that, everyone. My other dog that is here got spayed yesterday, and she's wearing one of those plastic hoods, and she's cones, and she's scratching that, so I apologize for that too. So yes, I bring my dogs into work. They like it, and my patients actually like it too. But poor Halo's wearing her cone there. So anyhow, I would double your probiotics or get started in the Prescript Assist Pro, okay? All right, that's one thing I would do, okay? Make sure you don't have the C. diff. And yes, the idea that you might have a virus infection is a valid one. We need to consider if people have virus infections as well, too, okay? All right, so that is the response to that question, all right? So let's see where we are. Thank you, I wish you well with that too, okay? All right, let's see here. Huh. Some of you are writing to me that we might be having a hard time with the screen share here tonight. I'm sorry about that. It's happening. I'll have to look at that tomorrow and see how I get that to work better here. Okay, so I'm sorry if that is what's happening here. Interesting. All right. Let's see. A question from Jane. She says, is IGeneX Western blot test accepted by the IDSA and CDC? The answer is no. They purposely try to discredit the lab because they don't agree that people have chronic Lyme disease, basically. What I would say about IGeneX, though, is that they've passed numerous quality studies, okay? And those quality studies, they have certificates. They're even approved by Medicare to run their test. They're actually a very good lab, okay? All right. All right, everyone. Listen, I'm going to need to wrap up for tonight. I'll have to show you why. Okay, everyone. This is Halo, okay? And she just had surgery yesterday. She's whimpering at me to say, I need to go out. So I'm sorry, but I need to take Halo out, okay? So let me put her down here, and I'm going to wrap up the webinar, and then Halo gets to go out. Anyhow, we're stopping about 4 minutes early, all right? I've enjoyed being with you here tonight. I hope you join me next week. Tomorrow, you're going to get an email that will have a link to the sign up for next week's webinar. It also have information about how to find the recording of tonight's webinar as well too, right? It's been good being here with you tonight, and I wish Halo didn't have to go, but Halo's got to go, and so I need to go ahead and be nice to her. All right, Look forward to seeing you guys next week. Oh, in a minute here, as we leave the webinar, if you're interested in going back to our Treat Lyme site to sign up for the book or to sign up for the next webinar, I'm going to redirect you there here in just a second. So here we go with that. So many of you should actually be just redirected there altogether. All right. And all right. Good night, everyone.